Now for section 8.7, we are going to compare our upper and lower limbs. Our upper and lower limbs share common features based on evolutionary history. They're going to exhibit differences based on their primary limb functions. We'll see that the proximal parts are going to be supported by a girdle of bones, and we have our pectoral girdle, which is pictured over here for holding the upper limb in place, and our pelvic girdle that is articulating with our lower limb. Some similarities that we're going to see is that the proximal part of our limbs are going to have one large bone, whereas the distal part is going to be comprised of two bones, and they'll be able to slightly pivot. And the wrist and proximal hand and foot are going to contain multiple bones, and this allows for a range of movement. If we look at our feet and our hands, we'll both have 5 metacarpals and metatarsals, and each will have a total of 14 phalanges. Our lower limb is going to be weight bearing, and we have some mobility that we sacrifice in order to have greater stability here, whereas our upper limb is not weight bearing, and our arm and forearms are relatively lighter, and we're going to have more mobility and can be used for multiple activities. We'll also have more mobile joints that are unfortunately less stable, so we have incidences of injury taking place more. Let's take a look at the pectoral girdle. This is going to articulate with our trunk, and it supports our upper limb. It's going to consist of our clavicles and scapulae. Our clavicle, which is known as the collarbone, is an elongated S-shaped bone, and it extends between the manubrium of the sternum and the acromion of the scapula. We see the portion that's going to articulate with the sternum is called the sternal end. This is roughly pyramidal in its shape and is going to, like I said, articulate with the manubrium of the sternum, which we see right in here, in order to form our sternoclavicular joint. The acromial end, which you see over here, anterior and posterior views, superior and inferior views, and also we see it articulating with the acromion over here. It is broad and flattened, and this is going to form the acromioclavicular joint. Our clavicle has in its superior surface that will be relatively smooth, and the inferior surface is a little bit more roughened. We're going to see that conoid tubercle, which is a rough tuberosity on that inferior side near the acromial end. We have a costal tuberosity as well that is inferiorly located and prominent near the sternal end. And we're going to have attachment of the shoulder's costoclavicular ligament. So you can see that ligament down over here, and it would be attaching to this costal tuberosity. Now when we look at the scapula, we know that it is called our shoulder blade, and I'm going to switch to a posterior view to show you the spine of the scapula over here. So we only find that spine posteriorly, and it's just a ridge of bone. We also have the acromion. This is a large posterior process forming the shoulder's bony tip, and it's continuous with the scapula's spine. Inferior to that, we're going to have your coracoid process. This is smaller and more anterior projection on your scapula, and it's a site for muscle attachment. Our superior border here is going to be a horizontal edge of that is superior to the scapula spine. Our medial border, which is also called our vertebral border, is an edge closest to the vertebrae. And our lateral border is the edge closest to the axilla, so it is also called your axillary border. If you look just inferior to your coracoid process, you'll see this little divot in here, and this is called your suprascapular notch. This provides a passageway for a nerve and some blood vessels. Now let's talk about the angles. Here we have your superior angle that is found between your superior and medial borders. You have your inferior angle found between your medial border and your lateral border. And lastly, your lateral angle which is going to be primarily made up of your glenoid cavity. This is a cup-shaped shallow surface, and it articulates with the humerus. If we look at an anterior view of the scapula, we can see our subscapular fossa. This is a broad anterior surface of the scapula, and we have a muscle that lies in here called subscapularis muscle. Now, if we look at a posterior view, we can see your supraspinatus fossa. This is a depression found superior to the spine, and we have a muscle that lies in here called the supraspinatus. Also staying on our posterior view, we see our infraspinous fossa. This is inferior to our spine of the scapula, and this is called the infraspinatus muscle. Now let's continue on to the bones of the upper limb. We'll see our components of the upper limb. We have the brachium, which is the arm, our antebrachium, which is the forearm, and the hand. Our bones of the upper limb are going to consist of one humerus, one radius, one ulna, 8 carpal bones, 5 metacarpals, and 14 phalanges. Starting with our humerus, this is our longest and largest upper limb bone. The proximal end has a hemispherical head, and it's going to articulate with the glenoid cavity of our scapula. On here we see a greater tubercle that is positioned lateral to the head, and it helps form a rounded contour of our shoulder. Our lesser tubercle is going to be smaller and more medial to the head. And in between these two tubercles, we have an intertubercular sulcus. This is a depression that contains the tendon of the long head of our biceps brachii muscle. Just below the head, we're going to have an anatomical neck. It is found proximal to the tubercles of the humerus, and it's going to be a groove marking location of a former epiphyseal plate. We also have another neck in here called the surgical neck, and this is where we have a narrowing of our humerus, and it's found immediately distal to the tubercles. And this was named surgical neck because it is a common fracture site. The shaft is going to be this long portion of our humerus, and it does have this area midway that is roughened, and this is called your deltoid tuberosity. It's going to extend along the lateral surface for half of the length of the humerus, and our deltoid muscle is going to attach here. If we look at a posterior view of our humerus, we have something called the radial groove. This is located just adjacent to that deltoid tuberosity, and it's where we're going to find the radial nerve and some blood vessels coursing through. Together, our bones of the humerus, radius, and the ulna form the elbow joint down in here. On this distal portion of the humerus, we have our medial and lateral epicondyles. These are bony side projections on this distal humerus, and it's going to provide a surface for muscle attachment. And you could palpate this on your elbow yourself. We also have this special area called the groove for the ulnar nerve, which isn't labeled here, but it sits right along here, in which the ulnar nerve is going to travel posterior to this medial epicondyle. And when we compress that nerve against our medial epicondyle, we say we hit our funny bone. Now we have two curved surfaces down here at the distal end where we're going to have articulation with the bones of the forearm. First, most lateral, we have the capitulum. This is going to articulate with the radius. Specifically, the head of the radius is going to rotate around the capitulum. And then we have the trochlea that's located medially. And this is going to articulate with the trochlear notch of the ulna. When we look at the distal end, once again, we're going to see that we have three depressions. Two of them are found anteriorly and one of them are found posteriorly. Our radial fossa is found superior to your capitulum, and we see that is anterolaterally placed, and it accommodates for the radial head when the elbow is in flexion. Here, more anteromedially, we have the coronoid fossa, and this accommodates for the coronoid process of the ulna when the elbow is flexed. And then lastly, posteriorly, we're going to find your olecranon fossa, which accommodates for the olecranon process of the ulna when the elbow is extended. Now let's move into our forearm. We have our radius and our ulna. These bones are parallel to each other, and the radius is going to be found laterally. We see that we have a head of the radius that is found proximally, and it has a disc shape to it, and this will articulate with the capitulum of the humerus, and then a narrowed neck that extends from the head down to this bumpy area known as the radial tuberosity. This radial tuberosity is going to serve as an attachment site for the biceps brachii muscle. And then we have our shaft of the radius that curves just slightly, and toward the distal end we can find the styloid process, which is just a bony projection. Then we have this area in here in which we're going to find the ulnar notch. This is going to articulate with the medial surface of the distal ulna. Now for our longer or more medially placed bone of the forearm, this is our ulna. We could see at the proximal end we have this C-shaped trochlear notch, and it's going to interlock with the trochlea of the humerus. At the very superior portion, we have the olecranon or olecranon process, which is a projection on the postero-superior trochlear notch, and this forms the posterior bump that we feel on our elbow. More inferiorly, we have our coronoid process, and this is the inferior lip of the trochlear notch that'll articulate with the humerus. If we move further inferior or distal, we have your tuberosity of the ulna or ulnar tuberosity, and then our shaft is going to terminate in a knob-like head here. And extending from this head, we see this point here. This is our styloid process. You can also palpate the head of the ulna if you feel the medial side of your wrist. In between these two bones, we have this interosseous membrane, and this membrane is attaching to the interosseous borders of both bones that are facing each other. This membrane is made up of dense regular connective tissue, and it helps to keep the radius and the ulna a fixed distance apart from one another. It's also going to allow for this pivot of rotation for the forearm. So when the bones are side by side, we are in supination, like you're holding bowls of soup, but when it crosses over, or you see the radius crossing over like so, that means the forearm is in pronation, meaning your palms are facing downward. So let's talk a little bit more about supination. Like I said, when our two forearm bones are parallel to one another, we are in anatomical position and our palm of our hand is facing anteriorly. So that would mean that our palms can hold a bowl of soup. And of course, our radius is on the lateral side and our ulna is on the medial side. In pronation, we are going to see that the radius is going to, and the ulna, is going to be pivoting along that interosseous membrane so that the palm of our hand will be facing posteriorly, or in this instance, it's facing down because we are flexed at the elbow. Our head of the radius is still on the lateral side of the elbow, but we'll see that the distal portion of the radius has crossed over. And just to talk a little bit about carrying angle, with our upper limbs extended and our forearms supinated like we see in this photo down here, the bones of our forearm are going to form an angle laterally from the elbow joint. And we can see that within males this is going to be about 5 degrees, and within females it will be 10 to 15 degrees. It helps to position our forearms so that we can clear our hips while we're walking. And typically we'll see with the 10 to 15% that this angle is wider in females. Now onto our carpals. Our carpals make up our wrist bones, and it's going to allow for multiple movements at the wrist. They're arranged in 2 rows of 4 bones each. So our proximal row here is going to consist of our scaphoid, lunate, triquetrium, and the pisiform that kind of sits atop the triquetrium. And then we go back here to the lateral side where we're going to have trapezium, trapezoid, captate, and hamate that has a distinctive hook to it. Then beyond our carpals, more distally, we are going to have our metacarpals. These are the bones in the palm of our hand, and they're going to articulate with the distal carpal bones here. They help support our palm, and we refer to them in Roman numerals 1, 2, 3, 4, and 5. Our metacarpal 1 is at the base of our thumb, and we'll see that metacarpal 5 will be the base of our little finger. And now for our phalanges. We have 3 phalanges in digits 2 through 5, but in digit number 1, which is our thumb or our pollex, we will only have 2 phalanges. Our proximal phalanx will articulate with the head of the metacarpal in all of our digits, and then our distal phalanx will be found at the tips of our fingers. And our middle phalanx, which we only find in digits 2 through 5, will be found between the proximal and the distal phalanges. A quick clinical view on our scaphoid bone. We have scaphoid fractures that can take place, and this is one of the more commonly fractured bones in our body, and this can fracture from a fall on an outstretched hand. Our blood vessels in that area can be torn, resulting in avascular necrosis or death of bone tissue that is due to inadequate blood supply there, and the results are in a long healing time. And here we can see our scaphoid region where we have that fracture can develop in pain and swelling and reduce wrist extension.